Hey, good morning. I'm Dr. Stites. I'm Chief Medical Officer here at the University of Kansas Health System and Executive Vice Chancellor for the University of Kansas Medical Center. Welcome back to Open Mics with Dr. Stites and our monthly edition of my favorite show, Show Me the Science. Today, we're exploring the benefits and the barriers about breastfeeding. It's pretty remarkable that even with all the advances in chemistry and technology, naturally produced breast milk remains the ideal nutrition for infants. It has nutrients, calories, antibodies, hormones, everything needed for optimal growth and development. It's best for baby, it's best for mom. That makes it best for dads. But here's the problem. Most infants are not meeting breastfeeding guidelines. Helping me with this discussion is Dr. Levia George, a neonatologist specialized in breastfeeding and lactation who works here at the University of Kansas Health System and at Children's Mercy Hospital. Welcome aboard. She is also the medical director of the health system's neonatal intensive care unit, or what we call the NICU or the NICU. Michelle Finn is a lactation consultant and the lactation team lead at the University of Kansas Health System. Welcome. And Ashley Bartz is a mom who does breastfeed. But she doesn't just breastfeed her own baby, she also regularly donates milk for other babies. And we're going to learn why that's so important in just a few minutes. But I will start by pointing out most babies are not getting breastfed like the guidelines recommend. And Dr. George, different groups have different guidelines. Walk us through them, walk us through what's going on out there.
Yeah. In general, most of our professional organizations agree that breastfeeding is the best for baby and mom. And even though different groups do have slightly different guidelines, in general, they all agree on some basic concepts, which is breast milk is best for the baby. And most groups do recommend exclusive breastfeeding until 6 months of life. So if you look at the American Academy of Family Practice, they say exclusively breastfeed your baby for the first 6 months of life, and then thereafter start introducing complementary foods, but still continue breastfeeding along with complementary foods, at least until 1 year of life. Now, breast milk does have benefits after 1 year of life too. It doesn't stop being beneficial at 1 year of life. So the AAFP, the American Academy of Family Practice, suggests that you continue breastfeeding at least until the 1st year of life and continue beyond that, as long as mutually decided by mother and baby. The AAP and ACOG, which are the organizations for pediatricians and for OB-GYNs, their recommendations are very similar. They recommend that moms breastfeed their babies exclusively for the first 6 months of life, and thereafter introduce complementary foods, but continue breastfeeding through the 2nd year of life up to 2 years old or longer, as long as mutually decided by mother and baby. So there's really not an upper end cutoff of age where breast milk suddenly becomes not beneficial. So AAP and ACOG recommend breastfeeding up to 2 years of life. If you look at it at a more global level, WHO, the World Health Organization, and UNICEF recommend the same things, which is breastfeeding until 2 years or beyond, as long as mutually decided by the mother and baby, and exclusive breastfeeding for the first 6 months. So you hear a theme here. Exclusively breastfeed till 6 months of life. After that, continue breastfeeding with introduction of complementary foods, as long as mutually decided by mother and baby.
So now, in your experience, why aren't more breastfeeding parents meeting these goals? What are the barriers?
So, even though breast milk is the best for baby and breastfeeding is the best for mom, there are a lot of barriers. The biggest being education and the lack of support. In terms of education, a lot of moms just do not know about the benefits of breast milk for their baby, but also for them. So there's a lot of barriers, both on the healthcare system side as well as the patient side, where they do not realize regarding all these benefits. The other major barrier is the lack of support, both at a healthcare level as well as a society level. So just to kind of put that into perspective, CDC puts out report cards every 10 years or so about where are we in our breastfeeding, goals. So if you compare to 10 years ago, we are in a much better place. So the most recent report card in 2020 showed that about 84 to 85% of the moms do initiate breastfeeding. And that's a big improvement from 2010. And kind of a reflection of all the public health focus and initiatives aimed at promoting this. So a lot of moms, if you look at that, they intend to breastfeed. 85%, that's a vast majority of moms do want to breastfeed. The challenge is when you look at it at 6 months, which is the duration that's recommended for exclusive breastfeeding, the exclusive breastfeeding rates are only about 25%. And only about 50% of moms are doing any breastfeeding at 6 months. So what are we missing there, right? They start out well, but there is this steep drop off. And if you look at that graph, there is this rapid decline that happens around the 1 to 3 month time frame, which is when a lot of moms are returning back to work. So just points to the lack of societal support and support for breastfeeding moms in general. So lots of work to be done, both in education and providing support to moms, because breastfeeding is not easy. It's natural, but it's not easy.
Education and advocacy. I know my wife did for the first 6 to 12 months for all of ours, and then I said, but it is a lot more work, and then you have to freeze the milk, you have to get up, you have to warm the milk, and but I do, that it makes total sense when you think about it from the baby's perspective. Gosh, what the best possible health outcome. So Michelle, how do you discuss these recommendations when you work with new parents? What kind of reactions do you get? Do they look at you kind of like, whatever?
I think as a society, as culturally, I think most people do understand that breast milk is optimal and that breastfeeding is usually what most parents plan to do. We have about a 90% initiation rate of breastfeeding in our kind of metro area. So most parents do want to do this, although the barriers start very early. So I think it's really important that we might share public health guidelines like the AAP and ACOG, and these organizations are not really speaking directly to parents, right? They are speaking to health organizations, they are speaking to policymakers. What can we do to make sure that the systems are in place to help support families so they're able to meet these guidelines? So yes, you might say this is what is recommended. Breastfeeding until 2 years, whoa, a lot of people have never seen a 2-year-old breastfeed, right? Or have the concept of what that might look like. Breastfeeding a 2-month-old or a 2-week-old is very different than a 2-year-old who might just come to breast once or twice a day or something maybe. So we really encourage families to just take it one day at a time, 1 week at a time, setting those goals as we go, and just recognizing that this is such an individualized choice. It's an individual, it's a family decision, and we just need to make sure that all the institutional supports around that family make it easiest for her to do what's optimal for herself and her baby.
Yeah. So now, Dr. George, you told us that comparing breast milk to formula is comparing apples to oranges. You shared a slide with us. What does breast milk offer that formula does not offer?
So breast milk and formula are very different. I mean, they do serve a common purpose, as in they provide nutrition to the baby. But if you compare even the nutrients in the two, nutrients in breast milk are a lot more easily digestible and absorbed than the nutrients in the formula. For example, one of the carbohydrates in breast milk is the human milk oligosaccharides. And this is such an important component because it, other than providing nutrition, it also helps decrease gut inflammation, help the growth of beneficial bacteria in the gut, and gut health is so important to overall health. So that's just one example of where you have similar nutrients, but they're so different from a biological perspective. In addition, I think of breast milk as a living, dynamic fluid because it has white blood cells, it has enzymes, it has proteins, it has antibacterial properties, it has antiviral proteins. And one of the most unique aspects of breast milk is that each mother's breast milk is tailor-made for her baby. So anytime the baby is sick, mother's breast milk changes to provide specific antibodies to the baby. Anytime the mother is sick, mother's milk provides antibodies to protect the baby. So every mother's milk is uniquely made for their baby, and that is something that formula just cannot replicate.
Isn't that amazing that how the breast milk can change when the baby's sick to help? So another slide shows breast milk versus formula under a microscope. Talk to us about what we're seeing here.
This is just a very interesting slide that shows how breast milk, excuse me, how breast milk is a living fluid. So as you can see under the microscope, breast milk has about 4,000 cells per cubic millimeter, and these are immune cells, white cells, just a representation of how it has so many immunological and anti-inflammatory properties.
So really, breast milk coming from the body is a whole lot smarter than the formula coming from a can. And I mean that it's smarter because it's better for the baby and it's got things in it that the formula doesn't have. Now, Michelle, how else does breast milk benefit baby? And also, Dr. Olivia mentioned that breast milk benefits moms. Talk to us about that.
Yeah, absolutely. I think sometimes we hear a lot about the benefits for the baby. There seems to be a good understanding of those benefits for infants, but we don't always think about from the breastfeeding parent side. So, but for an infant, for a baby, those benefits are reduced risk of infections of various kinds. So ear infections, respiratory infections, reduced risk of type 1 and type 2 diabetes, reduced risk of SIDS. Actually, I think that's pretty profound risk reduction for sudden infant death syndrome, which is quite prevalent in our metropolitan area. So even being able to reduce risk of SIDS by a small amount could have a significant impact on public health. So I believe the study is 4 months of exclusive breastfeeding reduces risk of SIDS by up to 50%.
Wow.
So
that's a
pretty
big
massive.
darn deal, right? That's a
Yeah,
big darn deal.
yeah. And from a maternal standpoint, from that parent standpoint, reducing risk of breast cancer, cardiovascular disease, like across the lifespan, right? So reduced risk of stroke and heart disease, years beyond those periods, those years of breastfeeding, and a dose-dependent risk reduction. So the longer, the greater the duration of breastfeeding and the more months, years across maybe subsequent babies that parent has breastfed, that risk reduction is just increasing over of that time at breast cancer and ovarian cancer and
It's like moms were made for
osteoporosis.
breastfeeding. I mean,
Yeah.
in some ways, right? I mean, they did because in the whole human cycle that helps. Okay, well, let's hear from Ashley and from Anderson. Hi, Anderson. What's up, brother? Your baby son, Anderson, needed some time in the NICU. Were you able to breastfeed?
I was. So Anderson was born unexpectedly at 34 weeks. And so we spent about 3 weeks or so in the NICU. And because KU has a private rooms, so we were able to breastfeed during our time in the NICU.
That's awesome. And so you were able to get skin-to-skin time even with him in the NICU because of that private room. Anderson, was that good for you? Did you like that?
He says yes.
I think he does. We're taking the smile as a yes. Now, Michelle, how does your lactation team help support our NICU families?
Yeah, so our lactation team is really here to support breastfeeding patients wherever they are through the whole health system. But a good amount of the time that is on our mother-baby unit. It is supporting those families in the NICU. Oftentimes, say with Anderson being born at 34 weeks, he probably was not able to go right to breast and just breastfeed, right? Maybe he needed a little bit of respiratory support, and we needed to help jumpstart milk production by milk expression very early on. And Ashley has been an absolute rock star with pumping from the very start. That commitment to Anderson and to other families too, which we'll talk about. But yeah, our lactation team meets with all breastfeeding families, and we're there to kind of individualize that care and meet with families, figure out what their goals are, and help support them along the way to overcome some of these barriers.
So we've just talked about how I take it you're still breastfeeding, is that right?
I am, yeah. He's 15 months, so he has no desire to stop anytime soon.
All right, awesome.
Smart guy.
Yeah.
Anderson, you look great today. I think you're doing pretty well today, and I got a question here about how you're doing, but I'm just going to say you're doing awesome. Well done. You are such a good guy. Now, we mentioned that you may be a donor to something called the Milk Depot. You're going to have to talk to us about what that means and what does it mean to be a donor?
Yeah. So whenever I started, so I've been breastfeeding and pumping based on our NICU experience, and that was the recommendation from the NICU when I first came home, was to pump and breastfeed. So I just kept doing it. I would breastfeed him, 6 to 8 times a day, and then I would also just pump 6 to 8 times a day just because I just did. I didn't really have a reason. I just did. That's what I did with my first, so that's what I was going to do with him too. And so I started having this surplus of milk where I was, probably pumping like 70 to 100 ounces at a time, which is a lot. And that is not the norm. Like that, I just am an oversupplier. And so I Googled online. I was like, okay, KU, NICU, how to donate milk to babies. And so there is a page on the website talking about the Oklahoma Milk Bank. So I reached out to them. You have to go through an interview process. You have to submit an application, do some blood work, things like that, just to make sure that you're a healthy donor. And then you just start donating milk. So I reached out to Michelle and have started donating milk. And I think I've donated about 3,000 ounces at least, if not more.
That's a big darn deal.
So
Where does the milk go?
It's really just a freezer that's in a closet. So our milk depot sounds like more than it is, but it's a reflection of our collaboration with Oklahoma Mother's Milk Bank, which is our region's closest Habana milk bank, so the Human Milk Banking Association of North America. So this is where we purchase milk for our families, for our NICU babies and other hospitalized neonates that need that pasteurized human milk. And if we have an approved donor that's in our region, we can accept that milk, hold that milk in our depot, in our freezer. They come up maybe about once a month, and we have this big pink van, and we load it up with all the milk. They pick up all the milk from the depots in the region, take it back to Oklahoma City. They pasteurize it, do some additional testing and all that. That milk is batched with maybe 3 or 4 different families, different mothers' milk that is mixed together, and there's additional, serology testing, things like that before it's, then sent back to NICUs and other hospitals like ours.
Well, that's amazing. Can Milk Depot be used from people who don't have to be in the NICU? Can you just be a parent who's not able to produce milk? Does that work for them too?
Yeah. That's what they said online, so it doesn't necessarily go to the NICUs. A lot of it does, because those are our most vulnerable babies, but it also goes to families in need, too.
Oh, wow. And so does the milk retain all its biological characteristics?
There are some, so fresh breast milk directly from mom is the best. Next would be pumped milk, which is not yet frozen. Next would be frozen and thawed milk, if you rank it in terms of benefit. Because the reality is, with the process of pasteurization and freezing and thawing and all of that, it does lose some of its biological properties, like some of the proteins, antibodies or proteins, they get degraded, the white cells are lost. So some of the properties are diminished with that process. But there is no question that donor milk is superior to formula. So just to give you a quick example, if you consider our NICU babies, one of the biggest complications we worry about in our preterm babies is necrotizing enterocolitis, which is a devastating inflammation of their gut. And donor breast milk is best for that, because breast milk compared to formula, breast milk is 6 times less likely. Infants who have fed mom's breast milk, 6 times less likely to have neck compared to babies who have fed formula. But there is also a benefit with donor milk, though not as much as breast milk. It's about 3 times less likely to have neck compared to formula. So breast milk does diminish in quality over time and with the pasteurization process, but it still retains a lot of its original benefits, including the oligosaccharides, which are so important to gut health.
Isn't that fascinating? And clearly, once again, the human body probably knows more than all the formula makers. So, all right, so when it comes to immunity, then is breast milk kind of like a vaccine? How does that line up?
Yeah, it is an interesting concept, right? Because a lot of times when we, especially for preterm babies who are so much at risk, when we go talk to mothers during their antenatal consults, one of the things we talk about is that colostrum. It doesn't look like much. It's thick, yellow, and maybe a few drops, but it's really an immunity booster, and it's kind of like the first vaccine for babies. The reason it's yellow and so thick is it's because it's chock full of antibodies and immunoglobulins and all those things. So yes, breast milk does have a lot of IgA and IgG antibodies, speaking in more scientific terms, and those IgA antibodies really do coat your gut and your respiratory tract mucosa, which probably has a big role in the beneficial effects it has in terms of reducing GI illnesses in breastfed babies, and as well as upper respiratory illnesses. So yes, it can be compared to the first vaccine for the baby.
That's what a terrific story, what a terrific program that kind of do this kind of education. And it sounds like to me you feel this is like a calling for you to go out and help the babies.
Yeah, it is. Yeah, I don't see myself stopping anytime soon. I have, I think, 3 full deep freezers at home. So.
Wow. Wow.
But I have reduced a little bit since he is, breastfeeds on command, so he's breastfeeding less. So I'm pumping less too.
Yeah.
So
now different cultures approach breastfeeding a little differently. Are there barriers to one culture or another? Or what do you think?
I think sometimes there are different, maybe different perceptions about the role of breastfeeding in different societies. And sometimes we can accommodate those things. Perhaps a very warm patient room might be something that we see, where you walk in and it feels very, very warm, and there's resistance to use any kind of cold because there was the perception that that would be harmful or would reduce milk supply, for example. Someone who has very engorged breasts after maybe 3, 4, 5 days after delivery would benefit from some cold. Sometimes families aren't so eager to do that, and they want to add heat, which can kind of exacerbate things, right? So sometimes we have to work to educate and counsel and work around these things. I think there was discussion about those, colostrum. Perceptions about colostrum can really vary, right? It looks different. It doesn't look like milk, right? It looks yellowish. It looks sticky. So without that education, you can understand why somebody might think, oh, I'm not going to feed that. I'll discard that, and then I'll breastfeed later.
Mistake.
So we do our best to kind of counsel but also individualize that care.
And how do we support folks who decide not to breastfeed? We made this really strong case this morning for how important it is. What do you say to people who say, oh, I don't want to do that?
Yeah. I think it's important that we explore it a little bit to understand what those, tell me a little bit about that decision. Sometimes it's a good open-ended way to ask that question. Sometimes there are misconceptions. Sometimes it's a concern about a medication, that the idea that maybe that medication would cause a harm to the baby, when in fact, with a little bit more information, most medications are compatible with breastfeeding. Sometimes people have had such a heck of a time with their first, and they just really are struggling with the idea psychologically of investing themselves. We all want to just be successful, right? And we all want to be good parents. And you can be a good parent whether you're breastfeeding or not. So I think it's just important that we have those conversations, educate as we need, and then fully support that family in their informed decision making.
We know there are some barriers that come about at work and things like that. I remember years ago, I wish it was a long time ago, but for many years, we, like with our residents or nursing or our staff, we didn't really have places for them to breastfeed or to pump, and that's changed a lot here. Talk to us a little bit about that, and what does it mean to be a baby-friendly USA designation?
Well, you're asking two totally different questions, so we're going to get to both of those. We'll get to both of those. Yeah, in the U.S., about 1 in 4 women go back to work within 2 weeks of having their babies. And you think about with C-sections and breastfeeding or not, this is a challenge. So when we think about societal support and policies that can be we can do so much more to help support families. So paid family leave would do a great amount of good for families, breastfeeding or not. But that return to work is a key tipping point, I think. And Ashley, you can probably speak to some of these challenges too. But that ability, you need a really good pump. You need that flexibility to be able to get off of your unit, your workplace, to be able to have a nice private place to be able to express milk. You need that time. You need that support from your employer. Do you want to share anything about your experience around that?
I thankfully work from home. So for the first 6-ish months or so, I was able to breastfeed Anderson while I still worked, and that made it so much easier. With my first, I didn't get that opportunity. I had to go back to work after like 9 weeks, and so you definitely see a decline because pumping is different than breastfeeding, and you don't get the same output, and those same emotional benefits are just so different, So.
Yep.
And you're right. There is nowhere for people to pump. There's nowhere for people to breastfeed in public or in a work setting. You just gotta find a floor and just people stare at you, and you just gotta hope you have a supportive family, which I thankfully have a supportive spouse who is like, do it whenever you want to, however you want to, but not everybody's like that. So that's really hard, and that's a big barrier for I think a lot of parents.
I love that you raised that point about it takes a spouse to help be supportive, so not put you in an awkward position. And 1 in 4, wow, in 2 weeks, that's tough.
It is tough. Just points to a lot of advocacy that needs to happen in this area, because yes, we are recommending that everyone breastfeed, but we really do not have a society set up for our breastfeeding moms to succeed. Just a lot of barriers in terms of parental leave, accommodations for pumping at work and things like that.
All right, we need to change that world. All right, so
I do want to
please,
speak to
you go.
were mentioning the Baby Friendly Hospital Initiative, and I do want to speak to that a little bit. So at the University of Kansas Health System, we are a designated baby-friendly facility, and that means we uphold the 10 steps to successful breastfeeding, which are were developed by the World Health Organization and UNICEF. They were really looking at global infant feeding practices, and they identified a set of evidence-based practices that are shown to be most supportive and helping families get off to a good start, because we know that early experience with that support and information and counseling and care practices at the very start make a really big difference. So we're, a third party recognizes us after a careful review of all our practices, policies, interviews with physicians, as well as bedside staff and parents about the practices.
Big deal, right?
Yeah.
It's a big deal. Anderson, you are being so good. But are you sharing treats or what? I mean, I just want to know who gets all the yogis here, Anderson. That's what I'm talking about. All right, we're here to answer your questions. Send them in using the info on your screen. That includes the chat on YouTube or Facebook or emailing the Medical News Network. We're going to check in with Doc Hawk. Hawkeye! Now, I love that little emblem there with the little wings moving. That's just, that's I don't got an emblem like that. You've got it. That's pretty darn good.
You get a whole show, so I think we're...
Yeah, I don't know, Doc. That's a pretty cool deal, man.
You get to be there in that room. I mean, look at Anderson. Anderson, he just looks dapper, right? He certainly classes up the show for sure.
Yeah, he does. He's much cuter than you are. Sorry.
Everything's looking good. Everything's looking good. We need him on some more. And I would just like to say I really enjoyed the part about the pasteurization. I think that's a very important point. And certainly we could probably expand upon that as much as possible, as much as we can. Certainly there may be some, it sounds like, reduction in some of the immunologic benefits for baby. But if we are talking about pasteurization in general for other raw milk that is on the market, that is not the population who is drinking the raw milk. It is probably mostly adults and children who don't need that, who are looking for more nutritional value. But just to point out that even with this process, even with this program, that breast milk is getting pasteurized. Pasteurization will help reduce the risk of infection, not only from mother's breast milk, but also from the raw milk that is being sold in different states around our nation, that is kind of seemingly increasing in popularity, but also exposing those to risks of infections. So I just wanted to point that out as well. But we do have some new COVID and flu RSV numbers. So overall, I would say in the nation, the numbers are currently low, but there seems to be some increase in the influenza activity around the nation. We have our most updated numbers from the health system, and as you can see here in this graph, this is again, percent positive graph. So just looking at all of the numbers of tests and looking at what percentage of those tests are positive for COVID, for influenza, and for RSV. And as you can see there, especially for COVID and RSV, those numbers are ticking up just a little bit. And again, that is percent positive tests. So as we will get further into respiratory virus season now going into the winter, we'll be doing more tests and we'll keep an eye on the percent positives. We also have, more importantly, I think for our viewers, are the admissions that we have here at the health system. And as you can see right now, the COVID admissions are very low. COVID is green. We have 3, but also we have a low number of influenza and RSV admissions as well. So currently low activity, but we should let the public know that influenza activity is increasing around the nation. RSV seems to be increasing as well. Again, for mothers-to-be, for new babies, we know that there are ways to help protect against RSV disease. And of course, for adults over 60, there is the RSV vaccine as well. That will help protect you from hospitalization and severe disease also.
Hawkeye, I like the graph because I like how low the COVID and RSV and influenza numbers are. And just to say it out loud, this is the lowest we've seen COVID in the last 3 or 4 years. And this time of the year, we'd have to go back to December 19 to see, because then we didn't have any that we knew of yet. But this is the lowest late November we've seen so far in the last few years.
Yeah, I'm very encouraged about that. Again, just was looking at the new data on the CDC website about COVID because we know since November 1 now, hospitals are mandatorily having to report to CMS. But overall, those markers for example, visits to emergency departments, hospitalizations, and deaths for COVID-19 are all at recent lows. And just as you said, I think that is good for everyone.
Yeah, we'll keep it down, and then we get to keep it down, which is awesome.
Yes.
All right. Alexis Del Cid is watching our questions from the community. Alexis, I bet there's some questions out there. This is going to be a hot topic.
I'm watching for questions, but I also have laser eyes on baby Anderson, the cutest. Can we just acknowledge what a good baby Anderson is?
Awesome.
I mean, he's the most calm guest we might have ever had.
Yeah.
Just give your guests
than
snacks.
your studio folks here. That's what I'm saying.
We have some great questions coming in. We have one from Jeremy Yenser. Jeremy wants to know, does breastfeeding help with postpartum recovery?
Yeah, that's a great question. Yeah, so as far as from the maternal standpoint, that early breastfeeding helps to bring that uterus back to pre-pregnancy size, and it does reduce that risk of postpartum hemorrhage. It doesn't eliminate it, but that process of having a baby skin to skin creates that oxytocin that does help with those contractions in labor, of course, and also does help reduce risk of that postpartum bleeding and helps with that early recovery. I think sometimes you'll hear things about you're more likely to lose your weight faster and things like that. These are hard studies to do. Sometimes I say that's kind of a squishy study to do. The research is more squishy there. But we do know that breastfeeding is a fat mobilizer. It takes probably 600-800 calories a day to make a full milk supply. So if you can kind of eat a regular varied diet and move a little bit every day and you breastfeed, you're definitely more likely to get back to that pre-pregnancy weight.
Anything to add, or anything does it impact postpartum depression?
That is an interesting question, because there are a lot of concerns about when we recommend exclusive breastfeeding, and if it doesn't go well, what's the impact on mental health for the mom? And there are studies on that too. And in general, it's shown to be beneficial to the mental health, diagnosis in moms, usually lesser anxiety and all of that. There are challenges that come into play when breastfeeding doesn't go as planned and the moms do not get the support to meet their breastfeeding goals. And in that situations, yes, it can lead to worsened mental health issues with the mom. And I think in all of that, the biggest thing to remember is a happy mom and happy and healthy mom is the best thing for the baby, and we need to support moms in whatever areas of their life that we can help attain those mental health goals as well. So I know that's a roundabout answer, but in general,
I think you hit a lot of important mental health points. Yeah.
Yeah, in general, it's beneficial, but it can lead to some mental health issues when there are barriers to achieving their goals.
Yeah, you bet.
We have a comment from Marcia. Marcia just is remarking at how much technology has advanced with the pumping devices. She writes, older pumping devices were a bit difficult and cumbersome to use. Today, there are much easier to use pumps that are so much more convenient. I was surprised when my grown children started having their own families, what great tools they have now at their disposal. There has been a huge advancement in how easy the pumps look and how much smaller they look.
Yeah, I remember the one my wife used to use. My wife's OB/GYN, and so, she would be pumping it all sorts of weird hours of the day, and she'd take some good time off. But that had to be, I was like, oh, things are kind of a machine here, but it's great to know that they're a little better, a little less cumbersome now.
They are. Some are better than others, and I do think we need more regulation around some of these. We see lots of families that have the wearable type pumps that are, can be quite convenient. Some are much better than others, and I do wonder, could we have a little bit more regulation? Because I do see that oftentimes if the pump is not as efficient as it needs to be, as moms, I think we're real quickly blaming ourselves before questioning the breast pump.
Itself, yeah. All right, well, this has been a great discussion. I want to get final thoughts from our guests. And Anderson, I'm going to start with you. Can you comment on the quality of the yogis you're eating? You say, look really good, and I'm hungry. So, awesome. I'm seeing a smile. That's good comment. Ashley, how about you?
I think that if you can try to breastfeed and have a support system to help you do that if that's a journey that you want to go down.
You know, I thank you for being on the program and talking about the things you've done and the donations you've given. That is pretty awesome. And Anderson, I agree with you. Alexis can be very funny looking and raise smiles. And you've really captured the thought better than I could, Dr. George.
So, we talked a lot about how beneficial breastfeeding is to mother and baby. So I just want to conclude with some thoughts on that. In terms of a public health perspective, just promoting and supporting breastfeeding is one of the most low-cost but high-return investment in public health that we can make that will have such a big impact on the community as a whole. So there's a lot of work to be done on that, and we need to be working towards that.
Well, I just thought that statistic you gave us about the 6-time reduction on necrotizing enterocolitis, which our audience knows is a devastating disease and often fatal disease in children. So that's, oh my gosh, what that in of itself says it all, I think.
And all the healthcare dollars that are saved too over there. It's a huge expenditure.
Yeah.
Additional NICU stay when someone has a complication like that.
I'm thinking of all the biological parts of breast milk as opposed to formula. It's pretty major contrast.
I think it's $13.9 billion saved annually in the United States if 90% of families met that 6 months, just to the 6 months mark. And I think that study is probably 10 years old now. So
maybe inflation accounted for it.
Might a bit, yeah.
Final thoughts?
Just to say that we are here to support you. There is support available if you are struggling. If you are thinking about breastfeeding and want more information, know that there are support groups. There is our lactation helpline. We teach a breastfeeding class each month as well, and we look forward to supporting you if you plan to deliver here.
This has been just a great discussion, and I think hopefully this gets repeated and talked about and pushed out there more and more. And Anderson, you're the best, so thank you for being on the program. I'm a Star Trek fan, and I love to talk about it, but I love that last thing, live long and prosper. I like to end with that because it's clear that breastfeeding helps you do that, to live long and prosper. And as we think about what are the things we do for each other, man, it feels like when moms breastfeed, that may be one of the best things that can be done for any person that we know. All right, so thank you for being on the program. Remember, faith, hope, and science together. Wow, that's a powerful story. We'll see you next week.
What began as a day of bowling for this couple ended with 2 ambulance rides and ultimately 2 surgeons from 2 different specialties working as a team to save Steve Oberhalben's life. That's December 5th at 8 a.m.
Subscribe to our morning medical update and Open Mics with Dr. Stites podcasts. Now everywhere podcasts are available.